Thanks for having me. I'm Samuel Taylor. I am a clinician. I'm a nurse. I'm a father, and currently working with CHP, Community Health Partnerships in the southeast of England. My current role looks at supporting integrated care systems, support the left shift into community of services, integrating primary care and delivering the recommendations of the Claire Fuller Stocktake. A lot of it lies in partnership working with stakeholders across community, the acute and primary care, understanding estates provision, developing capacity and capability within NHS estates so that we can deliver care in a sustainable way, increase access to services and take the pressure off the acute. I worked in consultancy earlier on before I joined the NHS, did some work in taxation before I decided to bite the bullet and train as a nurse and subsequently train as a health visitor in public health. So that's work in consultancy allows me to look at data, to model and to engage stakeholders from the private and public sector. I speak different languages. I've lived across different cultures, and that brings with it a certain level of resilience, being able to communicate across boundaries and reduce boundaries between services. For example, diversity of thought is something else that I believe I bring to my role, and a bit of disruptive innovation in systems thinking. So these are things that come across when working with diverse groups of stakeholders and when you bring in communities together. An example would have been during the pandemic when there were concerns and vaccine hesitancy. Jabali has been a beacon in terms of leadership, providing mentorship and sponsorship to me. They are a diverse group. I got to know Jabali at a low point in my career. Within the last 24 months, I was introduced to Jabali by Karen Bonner, who was the chief nurse for Buckinghamshire NHS Foundation Trust. She introduced me to Patrick Inyarambu. And the network has been instrumental in my professional and personal growth in the last 2 years. And they provide mentorship, they provide leadership, they provide pastoral care, and they've been invaluable. It's a no-brainer joining the Jabali network. As I said, having access to a diverse pool of leaders, of talent with a wealth of experience to guide you, to bounce ideas off, and to provide that constant mentorship, I think, and more importantly, to see leaders excelling who look like you, learning from people interested in your well-being, and the effect is transformational.